My name is Phil Hanlon, and I've been speaking with head teachers in Dumfries Galloway today, and what I've tried to get across is two ideas. The first is that health is a resource for living. We don't learn and exercise activities around health for their own sake. Rather, health is what is needed for us to achieve all the other good things in life that we want to achieve. The second is that teaching and learning for health needs to be holistic. It needs to address the environments in which learning happens, but it also needs to be specific. It needs to have its own activities that youngsters can engage with, and particularly develop the skills that are necessary to negotiate what is an increasingly challenging environment in Scotland. And that brings us on to what I call the good news and the bad news. The good news, of course, is that youngsters today are healthier than any generation that preceded them. Their life expectancy is longer, and the diseases they're likely to encounter in adult life are going to be lower than most generations before them. That's great. But there are also other challenges that have appeared which are in many senses unprecedented. So we think about the challenge of obesity, already prevalent in children and young people, but now over half of the Scottish population is overweight or obese. And that's a function of the environment we've created, which makes the gradual accumulation of weight all too common. Now, to overcome that challenge, youngsters need knowledge, yes, they need particularly skills to negotiate it, and we need to work hard to create an environment that is less prone to obesity, less obesogenic as it's called. The same is true of mental health and well-being. More youngsters today seem to be suffering from anxiety and depression. Adults have higher rates of anxiety and depression than previous generations. So although some aspects of health are getting better, we see in things like mental health, obesity, addictions, things getting worse. And there's no easy fix for these problems, just as there's no easy fix for the pattern of inequality which drives so much of these other problems. So what we seem to need to do is to provide youngsters as they grow up with knowledge, skills, the skills to negotiate these hurdles, but also a safe environment that is less prone to lead to these difficulties. Now that can be manipulated within the home, the community, the school, as well as the wider society. My job is to work on that wider society, but our opportunities to make schools less obesogenic, more supportive of health and well-being, less prone to addictive behaviour, that's a real opportunity that this Curriculum for Excellence offers us, and is a prize worth going for.